Hello and welcome to this edition of the Lynne Hayes Freeland Show. I'm glad to have you with me today. I don't know about you, but I didn't think we would get to April 2021 and we would still be talking about COVID-19. We would still be talking about the virus, and we would still be talking about inequities in our communities between African Americans, people of color, and the broader community. But guess what? We're still talking about all three of those, all of those. My guests today bring an interesting perspective to the conversation, and I'm very pleased to have three representatives from the Black Equity Coalition joining us today: Dr. Lisa Isaac, Mark Lewis, Dr. Tiffany Gary Webb. Welcome to you all.
Thank you. Thanks for having us on.
Thanks for having us.
And Dr. Gary Webb, let me start with you, because before we get into the nuts and bolts of a recent study that was done by the coalition, let's tell everybody who the Black Equity Coalition is.
So we're a group that came together about a year ago, concerned colleagues from different sectors who wanted to basically make sure that there was an equitable response to COVID-19. At the time, we were seeing news articles coming from all over the country about disproportionate rates of COVID-19 cases and hospitalizations and deaths in Black communities. And so we wanted to investigate what was happening here in Allegheny County and also, figure out what to do about that.
And Dr. Isaac, if I remember correctly, especially early on in this process, across Pennsylvania, there was very little data collected that had race as a part of the conversation. Am I remembering that accurately?
Yeah, that's correct. That's correct. And the Black Equity Coalition, I believe, was instrumental in pushing for getting race and ethnicity data included in the data that was gathered. Before then, you didn't see that. You didn't have that information, or there were big gaps missing. Even though you asked for it, it just didn't appear. It just wasn't there.
And Mark, here's the sad reality. There are people who will hear this conversation or have heard about the study that you get, the data collection that you guys were involved in, who would say, why does that matter? People are people. It does matter, though.
It does. And when you look at the data that we did receive, very early on, we saw, for example, there was one point in time where the cases that were impacting the Black community were 2 to 3 times higher than the cases impacting the white community. And so if you don't have the data that shows where the impact is, how do you develop the right solution? And so for us, data is critical. I mean, it's foundational to understand where the issues are, where the disparities exist. I'll be quite honest, when the pandemic first hit, my first thought to myself was, this is a virus that's going to level the playing field. It is airborne, it's not attacking any one community, it's going to hit everybody the same. And within a week, we started hearing about all the stories, as Dr. Gary Webb mentions, or Dr. Isaacs mentioned, in this community, it was hitting Black people, in this community, it's hitting Black people. And then it finally came to Pittsburgh as well. So not having that data is critical, because without the data, you can't develop the right solutions. And even if you develop a solution, where do you target the solutions?
And Dr. Gary Webb, I mean, Mark talks about developing solutions, but the realities are the data tells its own story.
Mm-hmm. Absolutely. And so early on, we developed a data working group. And we have, so the unique thing about our data working group is that we're bringing data scientists, so people who focus on data analysis, data access, data visualization, with those of us who focus in public health and medicine, with people from the business sector, from the community sector, and we take a data to action approach. So it's basically in real time, looking at the data, and then coming up with solutions. So not only just putting the data out there and showing what's happening, but giving it to community, giving it to stakeholders so that decisions can be made based on that data.
And Dr. Isaac, then when you start looking at this data, do you start with testing, and I'm just going to go to testing because I feel like this virus came, we got locked in our houses, everything got shut down, and then all we heard about was testing. But quite honestly, what I was hearing from our communities, at least in the beginning, was, where can I get a test? How can I get a test? There's no test.
Right. And when I came onto the data working group of the Black Equity Coalition, that was what was being the battle right then, to get testing available to people of color, to get it in the Black and Brown communities, and to get them the knowledge so they understood what to do, how to get testing done. And that was very important because obviously you got to have the testing so that you can treat or act appropriately. And with me being also the president of Gateway Medical Society, I was able to funnel a lot of the information garnered on the data working group back to organization of Black physicians and nurses and clinicians that could disseminate that knowledge in their practice as they were going through the pandemic.
And I just want to add to that because, that data to action approach that Dr. Isaac is talking about, we also were able to map existing testing sites. And at the time, there were only a couple of sites by our major health plans that were on the outskirts of the city. We were able to map where Black communities, where the majority of Black people in Allegheny County are, and where the testing sites were. And it just at that time seemed very inaccessible to a lot of those communities. So that data, as Dr. Isaac was saying, was put out to a lot of the physicians and so forth to understand that. We also, developed a strategy for the federally qualified health centers that are located in some of these communities to get testing services. So that was another piece of our coalition. We used the data from our data working group to feed that to our community health group and be able to get more access to testing.
And then if I can just add just real quick.
Sure.
The reason that is so critical is because when this pandemic hit, obviously this was something that nobody expected. Mm-hmm. So very early on, tests were limited, right? And so, we did not have enough tests to test everybody. We did not have enough tests to test everybody frequently. And so if you have a limited supply, what you need to do is figure out where does that supply need to go to have the biggest impact. And if we're saying the data is showing that the Black community is 2 or 3 times more likely to actually contract the virus, then you would think that testing would be 2 to 3 times higher in those communities, right? But if you don't have the data that shows you where tests are or where tests should go, then how again do you develop the right solution? And we end up with the same situation with the vaccines.
And I want to follow up on that, but I'm going to do that after the commercial break. Don't go away. We got a lot to talk about this morning on the Lynne Hayes Freeland Show. We'll be right back.